Good morning again. I'm Leslie Scoutt from Yale School of Medicine, and my second lecture this morning is going to be regarding ultrasound evaluation of ectopic pregnancy here, there, and everywhere. And for this presentation, I have no relevant disclosures. My objectives are to briefly review the epidemiology of ectopic pregnancies and to describe the ultrasound examination technique. But I'm going to spend most of the time discussing the ultrasound findings in patients with ectopic pregnancies with a particular focus on the ultrasound appearance of ectopic pregnancies in unusual locations. Ectopic pregnancies in the United States count for just under 2% of all pregnancies, although the incidence of ectopic pregnancies in unusual locations has been increasing over the past couple of decades. But it remains the leading cause of first trimester pregnancy-related deaths, and it's estimated to account for about 0.5 deaths per 1,000 pregnancies in our country. The good news is, though, that the mortality and morbidity of ectopic pregnancies has been decreasing as patients present earlier and we make the diagnosis earlier with transvaginal ultrasound. And a corollary of this is that about 80% of all ectopic pregnancies nowadays are stable at the time of diagnosis, and this, as we'll see, has significant implications for patient management. Risk factors for ectopic pregnancy, I think, are well known to all of you, and the most significant one is a history of a prior ectopic pregnancy. Other important risk factors include pelvic inflammatory disease, a history of or treatment for infertility, particularly patients who've undergone in vitro fertilization, a patient who's had prior tubal surgery, who has an IUD in place, or who has had a prior cesarean section. Endometriosis and advanced maternal age also increase the risk for ectopic pregnancy, and smoking increases your risk, as far as I can tell, of just about everything. But an important thing to recognize is that close to half of all patients with ectopic pregnancies have absolutely no known risk factors. So just because a patient doesn't have risk factors doesn't mean that you shouldn't consider the possibility of ectopic pregnancy. In terms of the technique, we focus on the transvaginal approach because this has the best spatial resolution for evaluating the anexa. And you need, of course, to optimize your technique. So you need to use the highest frequency transducer possible as you do your transvaginal exam. You want to optimize your focal zone by setting it just at or just below the area that you're looking at. Use any tricks that you have to improve resolution with post-processing algorithms such as harmonics or spatial compounding, and magnifying the images, particularly when you're looking at the endometrium and the anexa, can be extremely helpful. And recently, we've come to realize that three-dimensional imaging is a very powerful tool for evaluating patients with ectopic pregnancy, particularly for ectopic pregnancies in unusual locations.